Good afternoon. I'm Dan Meyer, publisher of BizTimes Media. Welcome to our webcast called COVID Era and Beyond, Managing Workforce Liability Under a New Normal. If you're like me, we can't get to that new normal fast enough. As we move closer to the point at which the stay-at-home order is lifted, now is the time to make some key preparations. Our presenters will touch on OSHA, workers' compensation, and employer liability as it relates to COVID-19 in the workplace. We'll cover what policies and procedures you need to have in place. Other topics our presenters will cover will include things like, should you be checking employees' temperatures? What about customers and privacy issues? What accommodations do you need to make if an employee or family member is exposed? What about virus and antibody testing? What factors do you need to consider to avoid discrimination claims as employees return to the workforce? What about employee benefits issues, and what is the role of health insurers in response to the current situation? The presenters will cover much more, and audience questions are encouraged. You can enter those questions on the Q&A feature on your screen. We'll try to answer as many questions as possible, but based on the many questions that we've received already before this webcast started, there's no way that we'll get to all of them. Also, the slide deck will be available after you fill out the survey at the conclusion of the program. Before we begin, I'd like to thank you for your readership support and for your print and digital advertising support and event sponsorships, and for attending this webcast today. This is our 25th year as an independent, locally owned family business. However, to serve this community for 25 more years, we'll continue to need your marketing and advertising support now more than ever. I guarantee we'll work hard every day to earn your business and to help you grow your business through our custom and integrated marketing programs, especially as you plan for your post-COVID-19 growth. In addition to our award-winning editorial team, they're always looking for story ideas, especially forward-looking operational insight stories that can help readers make more informed decisions in running their company, or insights on how to be better leaders themselves. So now on to the presentation, or to the presenters. So when I introduce you, please give a quick shout out to everybody. One of our presenters is Corrine Dykes-Johnson, President and Chief Executive Officer with Network Health. Hello, Corrine.
Good afternoon.
Gary Glake-Glatter, President, Horton Group Safety Consulting Team. Hi, Gary.
Good afternoon.
And Jim Colney, shareholder and labor and employment attorney with Davis & Kilthau. Hi,
Good
Jim.
afternoon, everybody.
Hello. And then Lori Meyer, shareholder and employment and litigation attorney with Davis & Kilthau.
Good morning, or good afternoon, I should say.
Yeah, that's great. So we're going to get things started. And to kick things off, Jim Colney and Lori Meyer from Davis & Kilthau are going to do that. So Jim, I'll turn it over to you. We'll get to the first slide.
Thank you. Well, it's been, what, about 33 days since the Safer at Home Act went in effect in Wisconsin. It's kind of been a long haul already for all of us. But now we're starting to talk about coming back to work, getting people ready to return to work. There's a real possibility, though, that during this process, as we return to work, if we haven't already experienced it, most of us will experience some sort of COVID exposure in the workplace. And what we want to talk about today, what we want to put out on the table today, is what to do about positive tests, what to do about expected tests, and then dovetail into how do those issues affect the return to work of the workforce. So my goal today is really to show you a bunch of resources that you can use. I'm going to be comparing the CDC and the Wisconsin Department of Health, their approaches to return to work and their approaches to what to do with COVID positive and COVID suspected cases. You'll notice that there are a lot of hyperlinks in my slides, and it's meant to be a resource for you. I will be going through the slides rather quickly just to kind of highlight some of the important issues that are raised by the slides. So with that, I'm going to get into the original CDC OSHA guidance on suspected COVID-19 positives or suspected contacts. Now, remember, this came out back in early March. This was a time when one of the bigger concerns was people traveling and coming back to the workplace. There were two different options that the CDC put on the table with its guidance at that time. One was what they called the minimum approach, and that was just telling people that came back on a flight, for example, to self-quarantine for 14 days. Another approach, the more aggressive approach, and the more typically used approach for those of us who have gone through situations where there have been positive COVIDs in different workplaces, involved a mandatory 14-day stay-at-home quarantine combined with a 14-day prior contact trace. And we'll talk a little bit more about that as we go along. Really, a 28-day period was covered. Identifying all people who had direct contact, notifying those who had physical contact with the positive employee, making sure you don't share the name, notifying health officials. This was the original guidance. Also, in the original guidance, close off areas visited by sick people and ventilating 24 hours before cleaning, and then some cleaning instructions. Now, I'm not going to get into the cleaning instructions. We have people that are much better versed in that in this panel who will probably address that. Moving on to April 8th. Now, things are changing a little in the workplace. We're starting to think a little bit about coming back. There's those two contradictory interests that are out there. Number one, getting workers back, getting that economy moving again. And the other thing, of course, is the public health. They don't always go hand in hand. And the stress between these two has had a lot to do with the way the regulations have come down. On April 8th, there was a considerable change in the CDC approach. They addressed critical infrastructure workers. Now, one of the questions we've had is, what is a critical infrastructure worker? You'll notice the second of the two hyperlinks I have there is to a CISA publication that goes through the list of who are essential critical infrastructure workers. It's a lot more than just the janitorial staff, custodial staff, or general or emergency responders. It's a considerable list of those people necessary to keep the economy running, is the idea that was being forwarded there. So a pretty broad swath of workers, those who are keeping the essential functions going right now. Now, under the new guidance, critical infrastructure workers were allowed to continue even after potential exposure. And potential exposure, one of the things that's kind of helpful here is they actually talk about what potential exposure is. Being in a household, notice it says being in a household. So we're talking about not just at work, but being at a household with somebody confirmed or suspected, time frame for having contact with individuals 48 hours before that individual became symptomatic. We actually have some sort of definition there. There are some other definitions that were used earlier, but that's the one that's in the CDC rule now. Then there's a protocol that we are to go through if one of these critical structure workers, infrastructure workers, has been exposed, pre-screening, monitoring, wearing a mask. Interestingly enough, in that first hyperlink on the last page, the CDC goes into different types of masks, what are affected, what's the difference between a cloth face mask, a medical face mask, etc. Social distancing, again, the site I gave you will give you considerable insight on what the CDC sees as social distancing. Also, we have another member of the panel who I anticipate will be covering that in more detail. Now, the CDC also at about the same time came out with a bunch of guidance on what happens when somebody's already been quarantined. When can you bring them back? And they speak in terms of two options, but they also do something that's kind of interesting. they insert a consideration of the symptoms that the person is going through. They really look much more at not simply when we discovered that there was some interest in COVID-19, but also when the exposure was. And this kind of allows for the movement of the time. The 14-day time limit you'll see isn't in this provision. It's the 14-day timeline of 14 days of quarantine takes into consideration the fact that, well, the person might have had the disease for a while before we noted it. So we have two options on how we're going to handle people before we bring them back. Again, concentrating on at least 3 days, 72 hours has passed since the fever has been resolved, improvements in respiratory conditions, and then 7 days since the first symptoms. A much shorter timeline is being used here.
I do want to say that these slides are going to be available. There's a question. They'll all be available afterward for you to download.
Okay. Discontinuing isolation for purposes of COVID-19, the second option is what they call the test-based strategy. And it has to do with people that have actually had access to and been tested. Again, as you can see through going through the slide, and I'm not going to detail it, it ties to when was the last test, how is the fever going, and how is the illness proceeding, and then 3 days following the discontinuance of the isolation, you still have to go through social distancing, limit dispersal of respiratory secretions by actually wearing a mask, not a respirator. The Wisconsin Department of Health, and I think it's important that people note what we just went through is the federal guidance. Wisconsin, we're going to be using as an example because most of our attendees are from Wisconsin. The Department of Health guidance here directly disagreed with what the CDC came down and said that's not going to change what we're recommending. Basically, what we're recommending is go back to slides 1 and 2 when the CDC was coming down and saying the 14-day quarantine, the 28-day period. That's Wisconsin guidance. Wisconsin directly says don't allow people to return to work after being exposed to COVID-19 for at least 14 days. Very much more public health oriented. The site that was on the hyperlink that was on the last slide is actually a very handy site. It's a pretty extensive list of different things that are covered by WPH. But moving to the next slide, one of the things I think is very helpful for return to work is they have a drop down of things like location, duration of exposure, potential routes of exposure, all the types of things you should be considering as you try to facilitate the return to work. Very handy site to go to. That ties into something that happened just a few days ago. Next slide. The Badger bounce back. We kid around that the bounce back is kind of like bouncing a medicine ball. I don't know that it's going to be a fast bounce back based on the criteria that are out there. But I give you the site to the actual bounce back project there. It's not a very lengthy document. And it starts with the notion of getting to a point in time where we can start facilitating return to work. And what bounce back suggests is that we have a downward trajectory within a 14-day periods of a new phrase, LIL, that's influenza-like illnesses reported, COVID-19 cases reported going down over 14, and positive tests as a percent of total tests going down. the notion is then we can treat all patients. Very robust testing programs, as I'll mention in a while. This is going to be used, that testing is going to help us walk through the 3 phases of the guidance for opening up America again that the White House has published. I give you the site there, and that goes through a bunch of different strategies that should be implemented based on a bunch of different categories of work, categories of susceptibility to the illness, etc. So the core state responsibilities are pretty substantial. Every resident who has symptoms can be tested. That's what they're looking for. They're talking in terms of 85,000 tests a week. Now, I'm not a medical expert, but we do have somebody on the panel that can probably give us some insight into that aggressive idea of testing. Once all the tests are together, the data is going to be managed. Heck, they're even talking about issues where your local health department might not be very well supplied and supplementing them through the state to address intense community spread areas, congregate areas like the prisons where there are concerns about outbreaks, and to help out even in business settings individually. Then there's tracing, case interviews, contact tracing protocols, how to go through that. We'll talk a little bit about that. One of our speakers will address that a little later. How you go through that. And the state's also going to create a contract tracing workforce to help you out with your contact tracing. Tracking, gathering data to update, educate, and evaluate. Maybe we can get a better handle on some of the issues surrounding this disease. So guidelines for all phases, you're going to see all the hygiene, face touching, sneezing protocols that we've seen from the very beginning in all the guidance that I've referenced in the prior hyperlinks. Business guidelines are encouraged, develop and implement policies. And I think that's a very important thing. Let's not forget the basics here. Having good policies based on guidance, legal guidance, really is very helpful to administering through these things. Obviously, they're talking about things like physical distancing, temperature checks, testing. All those things can be addressed in a policy and then applied to your employees. Again, Wisconsin, very big on don't allow symptomatic people to work, send them home. And then require, another thing very, very big in Wisconsin, not so big in the Fed, is require a medical provider before to okay the return. And again, working with local health to trace. So my conclusions and comparisons as I look through the guidance, obviously Wisconsin is, I guess the way to put it is more public health forward. Of the two sometimes contrary interests, Wisconsin is very much dedicated to the 14-day quarantine, the 28-day period with the contact tracing going back, medical return to work. There's a testing approach type of system that's being strongly suggested by the idea that there'll be aggressive testing and the emphasis on drafting consistent policies. The Fed guidelines emphasis is on critical infrastructure. It allows for assumptions with regard to exposure and symptom conditions and the progress of the disease. The Wisconsin, right now, more health forward. Right now, the Fed isn't quite so much, but it can shift in time as we move forward. And there's considerations of things like, will the disease bounce back? It's necessary that we're vigilant, keep an eye on developments, particularly as Badger bounce back is being implemented. Now, what I've done is I just kind of laid out basically the guidance that's out there. I'm going to hand this off to my partner who's going to go into a little bit more of the nuts and bolts of some of the issues that you may run into, legal issues you may run into. Lori?
Lori, take it over from here.
Good afternoon, everybody. The first thing I want to talk about today, I'm going to go through very quickly the EEOC guidance. It was, it says last updated in this slide, April 17th, which was last Friday. However, there's been even updates yet this morning after these slides were created. So I'll try to keep you up to date there. But the EEOC, as many of you know, is the federal agency that enforces anti-discrimination laws, and among them, the Americans with Disabilities Act. And so they obviously have been, a lot of questions have been posed to the EEOC about when you violate disability laws and things like that, when you are dealing with COVID-19 as an employer. The guidance that came out last Friday was a little bit more robust than some of the more recent updates, but that guidance said very clearly that an employer may ask employees if they are experiencing any symptoms of COVID-19 and screen employees for likely symptoms of COVID-19. In reality, what does that mean for you? That means that you can ask them if they've got it. You can even, I've had a lot of employer clients who have been talking about putting together some type of health questionnaire that asks questions like, are you having symptoms? Have you ever been tested? Has anybody in your household ever been tested? Do you have household members who are healthcare providers and that kind of thing? That's the kind of thing that the EEOC is going to say that that's acceptable. That's the kind of thing that you wouldn't in a normal scenario be allowed to do, but at least during the time of this pandemic, it's acceptable. You can take employees' temperatures before a work start. I know that Gary Glader is going to talk about that a little bit later, but that is acceptable. But from the standpoint of the EEOC, you may require employees to stay at home if they have symptoms of COVID-19 and require a doctor's note certifying a fitness for duty if after they've been cleared of COVID-19. Advanced slide. Thank you. Confidentiality of medical information. This is a separate section of the guidance that makes clear that any medical information that you may take from your employees, you must keep in a separate file, separate from their personnel file. And that means that if you're taking temperatures from folks, you may do that. You may even keep a log, day after day. And you should do that. If you do that, then it has to be kept separate, and the confidentiality of that information should be respected. An employer can disclose the name of an employee to a health department. If you have a COVID-19 positive employee, as we're going to talk about here today, you can disclose the fact that you have a positive COVID-19 employee in the workplace to other employees, but you shouldn't be disclosing their name. Of course, we recognize that especially in small workplaces, that's going to become, the identity of that person is going to become evident, but you should, to the extent you possibly can, not disclose that person's name. If the temporary agency or contractor is working in your workplace and places that employee at a workplace and later finds out that that employee is COVID-19 positive, then the temporary agency can tell the employer without violating any of the ADA laws. Hiring and onboarding really quickly. If you are screening job applicants, you can do that as long as the screening is done after making a conditional job offer. And medical exams, including taking temperatures, may be done again post-offer. Employers may delay the start date of employees who present with COVID-19 symptoms, not necessarily a positive test, but who have those symptoms. And you can, believe it or not, also withdraw an offer to a positive applicant if the employer needs the person to start immediately, and postpone the start date of employees simply because they are a part of it. But they may not do that just because the person is part of an at-risk group. Reasonable accommodations. The guidance from the EEOC basically says that the employers and the employees must cooperate to determine what reasonable accommodations might exist in the case of employee issues. One of those things that comes up when I talk about pre-existing conditions, let's say a person way before COVID-19 has panic anxiety disorder, OCD, maybe even depression, things like that that are exacerbated by the COVID-19 fear of it. The person says, and under this scenario, given my mental or emotional health issues, I can't do this. They might be entitled to reasonable accommodations, and the EEOC has made that clear. Some of the things that you can consider, of course, is consider telework when you haven't done that before. We'll talk about that in a minute, a little bit more in depth. The employers, of course, may request any and all medical documentation, just as you normally would, to determine accommodations from the medical provider, to get that information directly from a medical provider as opposed to just from the employee themselves. If time is of the essence, the EEOC has taken a departure from their normal advice in this scenario that you may forego the interactive process if time is of the essence, and you can simply skip some steps, so to speak. You might not need as formal of medical documentation as you normally would. And certain accommodations can be denied now given undue hardship, significant difficulty, or expense. Okay. Regarding return to work, believe it or not, the EEOC guidance is not that lengthy. The EEOC has simply said that the ADA permits employers today to make disability-related inquiries and medical exams if it is job-related and consistent with business necessity. And further, and this has been even made more clear given the guidance this morning, that the EEOC has expressly stated that COVID-19, an individual, an employee with a COVID-19 in the workplace is a direct threat to other employees. And that labeling of COVID-19 as a direct threat it entitles employers to ask questions that it normally wouldn't. Employers should accommodate employee requests for modifications to their job duties, protective gear if needed, things like that. When can and should an employer send an employee home? Based on what Jim was telling you about the Badger bounce back, and also from what the EEOC has said, employers must send home an employee or require telework if it's possible, if an employee is exhibiting symptoms of COVID-19. As you have likely seen, COVID-19 symptoms run the gamut from severe respiratory distress to more minor things that resemble allergies in the right individual. If it's possible that person might have symptoms but can still telework, that's what you should do. But in any event, they should not be in the workplace at all. Employers may send home or require telework a person who is asymptomatic, but who employer knows has had close contact with COVID-19. A person in the person's direct household, close friend, you for whatever reason know that employee has been in touch or in direct contact with somebody who's COVID-19 positive, you may do that and not run afoul of any of the federal anti-discrimination laws. And similarly, if somebody's returned from, say, New York City or something like that, and you know that, you may send them home under those circumstances. So what? I'm going to talk in a couple of slides here about what are the liability concerns from an employment perspective. What we're not going to talk about today is liability concerns to the, coming from the public, but just in the employment context, what kind of liability are employers concerned about here? So maybe in the context of Badger Bounce Back, you might be considering bringing your employees back not all at once, but in phases. So one of the, maybe you're going to bring certain folks back immediately, others part of a second step, and maybe there would be a third step when everybody's back. So you don't want there to be any claims that particular employees were treated differently, the why me, why was I treated this way? So, and that applies to all return to work decisions. Maybe you're talking about staggering shifts. That's one of the things that we talked about. Maybe one shift is much more favorable and desirable by your employees than others. So return to work decisions, you should really think about all of those to make sure you're not running afoul of, you're discriminating against folks in unlawful ways. Make sure things like employees' ages, races, ethnicities, general medical status, leave status, things like that are not factors in the decision. Frankly speaking, I foresee, based on some of the questions that I've been getting, that past families first Coronavirus Relief Act leave, that is the emergency paid sick leave and the expanded FMLA, you know, that there may be claims that, hey, employer treated me less favorably because I took that kind of leave and others didn't, and employer didn't like that, and so that's why I'm being treated this way. Be real careful there. Make sure that you can articulate that. What are the essential functions? What are the essential positions? That's maybe a legitimate non-discriminatory reason, and be able to articulate what those reasons are that you're treating one person one way and the other person differently. This is an important thing that's come up several times from my clients, is what if an employee refuses to work? Maybe the employee refuses to work because they're fearful of, maybe they've been furloughed for a period of time and they're fearful of COVID-19. Maybe they are refusing to work because, unfortunately, there is that group of people who would prefer to continue to earn that unemployment, that expanded unemployment. What can you do? If fear is the issue, you should be able, and certainly should, talk with the employee to alleviate any concerns. If telework is possible, certainly continue that. And then talk about all the steps that you're going to take that I'm sure Gary is going to talk about in a minute, about staggered shifts, social distancing, cleaning efforts, all the things that you're doing to keep them safe. Talk about that. If no telework is possible because that's simply not possible given what they do, and they're still refusing to come to work, but what they're refusing to do is an essential function, which is a required, you know, their attendance is necessary to do their job. They should be subject to discipline, including termination for refusing to do that. Now, you should recognize that there are going to be many employees that may be able to return to the workplace earlier than others, while vulnerable individuals may still be advised to stay at home. You might consider asking employees or allowing employees to voluntarily, they don't have to, but designate as either vulnerable or not vulnerable if you're doing the phases. For example, you don't want to make it just a broad blanket policy that says everybody over 60 is staying home till phase 3, something like that. You might want to consider that very carefully before you do that. What you'd want to do is maybe some employees might be fearful and because they fall into an immunocompromised category, and they may want to do that on their own. And you should be transparent and talk to them about that. And if there is any harassment, it should go without saying that, you know, if there's anything based on especially national origin, that kind of thing, or disability related jokes, you should be prepared to react. Everybody should understand, a lot of employers who have never had asked employees to telework or allowed it, you know, employers who have taken the position that telework is the exception and not the rule, we want everybody in place, you should be prepared for those requests to work at home to increase. What I mean by failure to accommodate claims is when you have employees who have disabilities, who have been permitted under this pandemic scenario to work from home, and you want, but under normal circumstances, you want that in-person collaboration or in-person supervision of the employee. You have to be able to articulate clearly why those essential functions could only be removed temporarily and on a long-term basis. Because what has happened is we're kind of caught in that catch-22 now. We have, in a lot of times, established, irrespective of the employer's desires in this regard, that, you know, they can work effectively and productively at home. So we don't want to have an ADA accommodation, failure to accommodate claim based on a rigid determination, I need these people to not telework. Real quickly, workers' compensation in Wisconsin. It is, at least as of now, the case that consistent with long time Wisconsin law, that contagious diseases, whether that be the cold or the flu or things like that, the employee has to show that that injury, that situation was work-related, and obviously that presents a proof problem. How does the employee demonstrate that they caught COVID-19 at work as opposed to at the grocery store or anywhere else? There is an exception in Wisconsin law for first responders. For first responders, there's going to be a presumption under work comp law that COVID-19 was contracted in the workplace. For all of you who have Illinois employees or who operations in Illinois where you have folks working there, you should know that Illinois is an outlier. Illinois has made it, they're one of two states, as I understand it, who has said that if a person makes a work comp claim, there's going to be a presumption, the presumption is going to flip, that the employee got that in the workplace. So you should just be aware of that, that difference in Illinois. OSHA has said that it will not enforce its record-keeping requirements to require that employers make work-related determinations for COVID-19 cases, except where there is objective evidence that COVID-19 was work-related and the evidence is reasonably available to the employer. There are exceptions for those in healthcare, emergency responders, and correctional institutions, but that is it.
All right, thank you, Lori. We're going to
Thank you very much.
Gary Glader. Thank you, Lori. Gary.
Thank you. Thanks, Lori. Thanks, Dan. So, yeah, let me give a little bit of background. I'm responsible for a safety consulting operation for the Horton Group. The Horton Group is a large regional insurance broker who has an office in Waukesha, Wisconsin. And when this hit, our consulting staff was basically grounded because we stayed home just as everyone else was staying home, except for many of our clients. That was our initial reaction to it, was to follow the orders. But then after a couple of weeks, we discovered that our clients really no longer needed the traditional services that we were offering. So we pivoted and began to assist our clients to develop and implement programs to address the spread of COVID at work and protection of employees. So we actually have some real-time experience right now with what many employers who have been at work since day one of this are experiencing. And I think it informs those of you on the call who are preparing to go back to work, because many of these companies and organizations that are working now, they've been living this, and there's a lot of information and insights that can come from that. Some of what we're seeing with our current clients are a spread of the virus at work. We have clients that are experiencing spikes in COVID-19 cases. Matter of fact, people on our consulting team, unfortunately, we have a team member who lost an elderly uncle to the disease and has an aunt and another uncle who's in the hospital right now. We have another member whose husband is a police officer. He's positive for COVID-19. So this is very real, and it is touching people, and I'm sure many of you know people who've been impacted. Another thing that we've seen with our clients is high absenteeism. People are just frightened. And it occurred to me, there's panic. There's panic among employers, there's panic among employees. Think about this. All of us, we watch TV, we watch the news, we watch updates, and they're imploring us to stay at home. Don't leave your home. In the meantime, how many millions of people in this country are going to work? When they get home, they're being told, stay at home, yet they're going to work. So these conflicting messages really don't help, and it is causing some panic and fright at work. Another thing, if you've discussed anything with an OSHA compliance officer recently, the complaints are at a record level. If somebody believes they're working with somebody next to them who might be ill, they're picking up the phone because they're panicked and they're calling OSHA to file a complaint. On top of everything else, personal protective equipment is difficult to source. I'll talk a little bit more about that later, but N95 respirators are like gold right now. And it's unfortunate because that's one piece of equipment that could really help everyone who's currently working or planning to transition back to work. And last but not least, and certainly most importantly, is our clients, who are really, I would say, in a middle market space, not your General Motors and Boeing corporations. They're in the middle market space. They simply don't know what to do. They're doing the best they can, but it's just not enough. Next slide. So obviously, we have this growing experience with employers who are currently working, and it's informing us what to expect in the future. And obviously, as we have infections begin to decline, Different states have different timelines. We're expecting that other employers are going to transition back to the workplace. Now, that's a big mystery because the people who've been off of work for all this time have no idea what to expect when they go back to work. Employers are concerned about the many issues. And Lori and Jim have talked about some of the legal concerns. Employers just don't know. And the fact is, Lori mentioned this earlier, things are changing literally on a daily basis. First, OSHA made the determination that the presumption is that COVID-19 cases would be work-related. And then they changed their position on that probably within a matter of weeks. So it's really important to stay as up-to-date as possible. The Horton Group is trying to do a good job of keeping our clients informed. I would encourage you to reach out, find information, and keep yourselves informed. Next slide. So when we look at anything really in safety, the first place that we start is to do a thorough assessment of the workplace. And that literally means going into a place of business, identifying what that business does, identifying the pathways of virus spread in that workplace. Now that's where it starts to get complicated because you have to look at lunchrooms, you have to look at restrooms, you have to look at machinery, tools, and equipment because the virus spreads one of two ways. One through contact, and that contact with the virus is then transferred into a mucous membrane. That's one pathway. And a second pathway would be inhalation. Incredibly, droplets that contain the virus can stay suspended in air for hours after a person has sneezed, coughed, or breathed. That's how fine and small those droplets are. And unfortunately, the one thing that's needed to protect from those small, tiny droplets, ideally, is an N95 respirator. Because unfortunately, a surgical mask or a cloth mask is not capable of filtering out particles that small. So after an assessment is done, the next step is to develop a written and very specific exposure control plan. That identifies the ways the virus can spread. It identifies social distancing, density reduction in the workplace. That would be by adding a shift to reduce the number of people that are in a particular workplace. And it also identifies the engineering, administrative controls, and personal protective equipment to prevent the spread. Once we develop the plan and develop the protocols to prevent the spread, one huge element is going to include training for employees and, more importantly, training for the supervisors on the exposure control plan and the personal protective equipment. The next point, which is to frequently audit the plan, really became apparent to us because we assisted a client several weeks ago in developing the exposure control plan and implementing the plan. It was great. 2 weeks later, we did an audit of their facility and found that about half of the items in the exposure control plan were not being completed. So a plan is great, but unless you come back and verify that the plan is effectively being implemented, the plan is no longer useful anymore. And of course, another element of the exposure control plan would be to investigate the possible occurrence of a COVID-19 case in the workplace and following all the other Wisconsin and CDC protocols. We did talk about this earlier. There's a necessity to do thorough, routine cleaning and disinfection of surfaces, restrooms, and common areas. The CDC is pretty clear on what this frequency is for each of those areas, and there's so much detail, I don't want to go into it now, but your exposure control plan should identify exactly what those frequencies and what those areas are. So we move along. I'm sorry, if you could go back a slide, Dan. The mental well-being of employees is something that everyone should address. And I believe Corrine is going to address that, but we need to address fear in the workplace. And probably the thing that leads to fear more than anything else is lack of information. So the more you communicate and the more you're transparent about what you're doing, the more confidence your employees will have to report to work. And as an added benefit, I think it's useful to talk to your employees about how they can address COVID-19 in their homes and with their families. I do want to close with a couple of slides because it's very interesting, especially for those of you who are talking about transitioning to work, but it even applies to those who are in the workplace. We're hoping, everybody has heard the issues associated with testing. We're hoping that additional and faster virus testing will help prevent the spread. But that only touches one piece. That only touches or identifies those employees who are currently infected and may be contagious. There's another type of testing, and maybe some of you have heard about this, called antibody testing. And once it's approved by the FDA and the CDC, antibody testing, if it can be proven to be effective, and there is actually immunity that's generated by obtaining these viruses or acquiring the viruses, may help employers repopulate workplaces. And more importantly than that, if I'm an employee who tests positive, I was asymptomatic with COVID-19, and I don't test positive for the virus any longer, I may have the confidence to know that I can't be reinfected again. Honestly, we don't know that yet, and that's one of the reasons why antibody testing has not been rolled out. It was interesting. A county in California where there were 9,000 positive COVID-19 cases, there was antibody testing that was done using available technology now. And what they discovered is they believe up to 440,000 people had already acquired the virus and had developed immunity. So out of 9,000 positive cases in this county in California, they believe, and we don't know for sure yet, but we believe 440,000 people were actually affected. That's good news when we look at the death rates for COVID-19, because we're only counting the number of deaths versus the number of confirmed positive cases. We believe and we hope that the actual death rate is far, far lower than what it is now. There's a Michigan hospital, in fact, involved in antibody testing, which should help show some results within the next month.
All right,
Next slide.
Gary. That was it. We combined those last two.
Oh, perfect.
So thank you so much. Now I'm going to turn it over to Corinne Dykes-Johnson with Network Health.
Good afternoon. Just wanted to give you a little bit of background about Network Health. Network Health is a provider-owned health insurance company. We've been around for 35 years. Our owners are Freighter Health System and Ascension, Wisconsin. And like many things right now with COVID, unprecedented times have called for some unprecedented tactics to address things, and healthcare coverage has been one of them. One of the things that we are experiencing as a health insurer is changes related to what we're required to cover. One of the things that's been provided, I think, pretty clearly to the community through both federal and state is that COVID testing is covered at 100%. So when you're thinking about your return to the office or return to work strategies, if you offer health insurance coverage to your employees, you can know that the testing for the virus is covered and there's no cost sharing that is applied to that. So that's been a change. No prior authorizations are required. One of the other elements that's changed is that because of what's been going on in terms of healthcare and access, that there may be a fear that, well, what if I can't get into my provider? What if I can't get the testing? So one of the changes that was made that is that if you can't get in to an in-network provider, you can go to an out-of-network provider and those charges will be covered. And again, you'll have no cost sharing that applies. It was mentioned earlier about antibody testing. This is one of the areas where coverage has gotten a little ahead of the science. So there is coverage for antibody testing. We haven't been able to prove that actually having antibodies in your system makes you immune to the virus, and if you do have antibodies and immunity, how long does it last? So that's still being worked out and tested, and we're seeing that on a national basis, really looking to be able to identify those antibodies. But in advance of that, it has been required for health insurers to cover that, and so that is covered if organizations, when it becomes available and the efficacy is shown, it will be available for coverage. I just want to talk a little bit about, we talked about prohibition of discrimination related to the workplace, but it also applies to health insurance in terms of information that we take related to rating and rate increases and such, that it's prohibited. It's similar to any type of pre-existing, can't consider it as part of the rating process. And again, one of those things that was called out separately as it relates to what's going on in the crisis. One of the things that we've seen as a healthcare system is, because many individuals, and hopefully are safer at home, their drug prescriptions are getting those 30, 60, and 90-day refills. And that was another thing that was changed. There are no limitations on that in terms of prior authorizations, with the exceptions of any type of Schedule II drugs, which are things like opioids and things of that nature. So those are some of the changes that have occurred. But when you're thinking about going back to work, it's the timing of it is really, how are we going to bounce back? So let's go to the bounce back slide. We talked about it earlier in terms of what does it mean. Earlier, the governor came out and said, end of May 26th was going to be the date that we're going to open up the state. And subsequent to that, he put out some guidelines, some phases, if you will, about how we will reopen. He's looking at symptoms of the cases, the number of cases. Is the healthcare system ready for us to open up? And what does that look like in terms of cases, as well as their access to PPE and the number of workers that are infected with with COVID? Testing, do we have testing available? There was talked about earlier, we have to get up to 85,000 tests, which means we need to be able to be testing at about 12,000 per day. What's our testing capabilities? Contact tracing, you've heard probably in many other states how states have hired individuals to go out to contact trace so that we can identify individuals who may have been exposed to the COVID, maybe asymptomatic, but how are we putting them in quarantine? And then finally, PPE, not only how are our hospitals and our healthcare workers set up? So I think it was one of those questions like, well, okay, so we know where we have to go, but where are we now? So let's look at this information. This is information that was taken from Department of Health Services, their website. It's, I believe it's updated as of the 22nd. But so this gives you an indication of the newly reported cases as of the 19th of April. You can still see that we're still on from that perspective, upwards slide. The number of cases over the 7-day average, or the last 14 days, we saw some leveling off, and then we saw a spike. Many of you probably heard about some of the meat packing and what's been happening in Brown County. So we saw that spike there. So we know we're not on the trajectory of 14 days of reduction. And then percent of people testing for COVID who have had positive results over the last 14 days. We saw some leveling off, and then we saw an increase. Next slide, please. So how is our healthcare system equipped to be able to handle opening up? One of the things we look at, licensed beds, and how many of those beds are available. So you can see that. What does our ICU look like in terms of those beds, as well as number of tests that are pending, and do we have enough ventilators? So this is kind of a snapshot of where our healthcare system is as of this week. And then on the bottom, how many of our healthcare workers have been diagnosed as a percentage of total cases? We need to see that decline, as well as ensuring that we've got the stabilization of healthcare to be able to open up. Next slide. So this is a slide that just kind of gives you a sense of the number of tests. The bottom slides really are related to what's our testing capabilities. Now and obviously we're seeing an increase in the testing capabilities go up dramatically. You may have seen the press release from the governor's office about the extensive outreach that he has done with Wisconsin healthcare entities who are ramping up their testing capabilities and getting the testing equipment to be able to meet the very aggressive number of tests that we have to perform on a daily basis. It's clear that we're not there yet, but this is where we are. The other thing that we need to do is contact tracing. So how are we going to get that done? We've got some recent information that 120 contact tracers have been hired, and what we've been told through DHS is that they will start to, as they get their system up and running, that they will be providing us with a public dashboard to let us know how they're able to contact and get effective tracing going forward. Next slide. This is the personal protective equipment for purposes of the hospitals. What hospitals with 7 days or less of their PPE, what you're seeing is that you know, the number that have less than 7 days is on the decline. Again, just another milestone that we need to be mindful of in terms of how are things progressing. You may or may not know that many elective procedures were reduced or canceled throughout the healthcare system. We are seeing reductions in our emergency room. All of those types of changes in the capacity, or if you will, the healthcare services, has helped to preserve the amount of PPE that's available to our healthcare workers. Next slide. So Network Health, we employ about 450 employees, and as a health insurer, we would be considered an essential business, but we made the decision early on that we were going to have all of our employees work from home. And we did a phased approach, and so we have 100% of our staff working from home. We have some employees that go in on a somewhat regular basis to ensure that, you know, mail and things are being distributed to our staff, because we still have to meet regulatory guidelines for timeliness in terms of responses. But we did it in a phased approach, and so we are working outside of the office. But we have to think about, how do we return to the office? Some companies will be looking at how do they return to work, but for us, it's how do we return to the office? And we heard a lot of things about, you know, our employees in terms of what's their mental health related to isolationism, and what are we doing as it relates to that. And our organization is doing a lot inside to inspire people. We've got a lot of things that the team are doing, you know, little projects within departments to help keep the energy and the morale up. But I don't think we can, you know, tread lightly that mental health issues associated with isolation are a real issue. And so how do we address those when we're bringing people back as well as when they're at work? One of the things that we're going to be doing is a phased approach, and it's really unclear when that will be, because we've got the end of May date, but we also, we don't have a timeline exactly when we'll be able to hit all those milestones. And so one of the things that we're looking at is what we can do to phase in our workforce, and what are those considerations. And it's everything from, you know, will individuals self-select not to stay at home? Will we decide that there are departments that we will not bring back into the organization, that will keep out separately? We made a decision a number of years ago to take a big area of our workforce and have them work outside, work at home. And, you know, we might be revisiting that to say we're going to extend that beyond what we currently have working at home. We're looking at all the same issues in terms of PPE usage, temperature screenings, making sure that we have appropriate social distancing. We're looking at how we'll modify the physical location, our configuration of our cubes. We're looking at all of those things to make sure that when we do bring our associates and employees back from the home and working in the office, that we have made sure that they can appreciate visually the number of changes that we've made to help them be safe. You know, PPE, while it is difficult to find, there are different levels that can be used. And one of the things that our medical director has been driving home in our teams is that those masks are to protect others. They don't necessarily protect you, but they do protect others. And so, you know, putting in guidelines and policies and procedures are going to be what we are going to be doing to make sure that we are protecting our colleagues. And everything from we call them collaboratoriums, or most people call them cafeteria areas. What does that look like? We've worked hard as a company to create a really positive, family-like, friendly experience at our workforce, where we have popcorn and coffee and, you know, these wonderful amenities for our employees. But now we have to look at those things differently in terms of whether or not we can continue to provide those. And if we do, how do we go about it to make sure that all of our employees are safe? And at Network Health, we work really, really hard to make sure that we put not only our members and the physicians that we work with, but also our employees' considerations at the center of what we do. One of the things that we're doing as we're looking at how to modify our location, we're looking to our clients. So if you go to the next slide, we have an approach to what we call it our hometown advantage. So when we're looking to engage any type of a vendor to provide services to our organization, we always look to our customers first. And Coakley Brothers Interiors is one of our customers. And what they've already got ready for employers is the ability to come in and be able to assess what's going on in your work site, and to help create ways for you to modify your work site to create a safe environment. Everything from, as you can see in the slide, some plexiglass barriers. They've got ability to create new type of shielding for cubicles. And one of the things that, you know, those kinds of directional things that we have to be mindful of. Our new normal is that we're going to have social distancing, but this is new, and it's going to take a lot for us to be able to transition from where we were, where, you know, we're doing handshakes and we're walking into people's office and we're clearly within that 6 feet distance. So what are we going to do to help our employees and our customers to be mindful of, hey, we need to keep 6 feet away. Maybe we have, you know, one-way traffic so that we're, you know, keeping the connectivity between our employees limited because we're going one way. Coakley has the ability to help us to do that so that we can be reminding our employees of ways that they can stay safe. So without any other questions, I'm ready to take it when you're ready, but we're Network Health is ready to help you in any of those other questions related to health insurance, and we stand ready to do that for you.
Great, and the email addresses for all these presenters is on the slide deck, so you can contact them at any time and they can do their best to answer some of the questions that we may not be able to get to. So we're going to start that right away. We've got probably a few hours worth of questions, but only a half hour. And again, this recording will be available on the website. So Gary, I want to start with one for you. What's the biggest concern you're hearing from your clients working in essential businesses and services? What's the biggest issue that you're hearing?
Biggest concern right now is they're concerned about the health and safety of their employees. Without our assistance, they felt helpless, didn't know where to start. So the other element of that, of course, and I talked about this before, is fear of employees. So I think what employers can do is to really take a deep dive, consider doing an assessment of your workplace, developing a comprehensive exposure control plan, and then communicating that plan to your employees. It will help prevent the spread, and it will give your employees the confidence to know that you're looking out for their best interests.
Okay, thanks. Corrine, this 88,000 tests per week, or anybody that has any insight on, how is that possible? Is that realistic? And that just seems to be just a huge number.
Well, I think initially it is, but we're in unprecedented times now. And so that's why the governor has reached out to numerous statewide, every healthcare entity, independent lab, looking at and working with them to substantially increase their ability to be able to do the number of tests. And so, the slide I showed you earlier about kind of what our current capabilities are, we have a ways to go. And in order for us to be able to hit those milestones, those phases that the governor has set out for us to be able to open up the state. But I would say this, Wisconsin people are very innovative, and my money's on them. They'll figure out a way to make sure that this happens.
All right, for Lori and Jim, if an employee becomes sick with the virus at work and dies, is my company liable?
I can answer that from a work comp perspective. In Wisconsin, they're going to have a very difficult time, at least in Wisconsin, proving that that they contracted the virus from the workplace and not from other situations. Now, if that is going to be something yet to determine whether there is going to be that particular case where the person had a clear connection to somebody who is COVID-19 related and couldn't have gotten it any other way. Jim, do you have any thoughts on that as well?
I think
and by the way, Illinois is a totally different case, but as I mentioned, Wisconsin, at least at this point, hasn't said that.
Yeah, from a workers' compensation standpoint, the fact that first responders are given a presumption suggests that we're going to maintain that the duty of the employee to come forward and actually prove that the injury has come from the work environment as opposed to was contracted elsewhere. Tough burden. It's going to be a very tough burden.
Jim, can we mandate the use of face masks, or could an employee refuse to wear a mask? Or Lori?
I believe they would be able to. I think, as I mentioned, I can't stress this enough. I think a wise course for an employer to follow right now is to look closely at the different suggested guidelines in Wisconsin, particularly those of the Department of Health, and use those as a basis to create policies, again, based on that guidance. Then taking those policies and being consistent and being uniform in the way they're applied, I think you're going to be in real good shape with regard to having a good course of action to follow and being pretty strongly protected against different types of liability.
Yeah, I think.
Lori, any thoughts on that?
I agree. I agree with everything you said, Jim.
Corrine, and everybody kind of mentioned this earlier, but Corine, can you talk a little bit more about the mental health side of things, regarding televisits and what you're seeing, what's happening out there, and companies who have EAPs or who need EAPs, and what kind of stress that they're seeing, and just the whole, get a little bit more in detail regarding the mental health, because that's a question that's been coming up a lot as we're all stressed out and trying to figure out how this is all going to work out for everybody.
So yes, absolutely. I guess I would say that one of our leading indicators that we're seeing mental health issues is that we've seen almost a 600% increase in the number of televisits for our behavioral health issues. What we're finding, we've been pushing our telehealth program substantially. I can tell you that we have not seen a similar increase in the rest of our visits. Our physicians can provide primary care visits and specialty care visits as well, and we've not seen anywhere near that increase. So we know that this is becoming an issue. What I would say is that for employers, to check, right, if you've got employees that are working from home, I would recommend that you reach out to your health insurance provider and find out what type of telehealth services that they have available, specifically behavioral health, and to communicate. I think it was maybe it was Jim or Gary who said earlier that, you know, one of the ways to manage fear is to communicate. And my recommendation is that this would be something that you want to provide as an ongoing information to your employees to make sure that they understand that these resources are available to them. Many large organizations also have EAP services. They can be very helpful in dealing with the stress and potential isolationism that is occurring. You know, one of the things that if you know, for many, I can't, you know, can't speak to everybody, but for many people, when you're going to telecommute, when you're going to work from home, you've got a nice runway to be able to make that happen. With this pandemic, many companies were doing this very quickly, which meant, you know, you didn't maybe have all of the time frame to get yourself in a position, both physically and mentally, to be able to deal with the stressors that are coming as it relates to working from home, never mind the stress from outside, you know, family and maintaining all of that. So again, can't emphasize enough to communicate. And one of the other ways is to also communicate other things that's going on in the organization, making sure that, you know, this information on COVID is moving quickly every day. We're getting more updates, we're getting more information, and we want to make sure that our employees are getting that information from us. There was a study that was done back in March that looked at where do people see information and trust, and one of the top high-level trusted entities to provide information was employers. And so we can be that trusted source of information for our employees that can help to also quell fears and to get them in a much better position.
Great, thank you. Gary, 2 questions. What is a reasonable amount of disinfection and sanitizing for a general office setting? And then what should an employer do if they receive notice an employee has filed a complaint with OSHA?
Yeah, let me address the OSHA complaint issue first. So there's a process that the agency goes through. First of all, understand that all of the calls they're getting right now are complaints from essential workers in workplaces where they're fearing the spread of COVID-19. So they know that they're getting a ton of these. They also know that they can't respond to all of these. So they're doing the best they can with the employee who files that complaint to screen through to identify if there are real concerns. We have a hospital client who received 2 complaints in one day. And what OSHA does is they communicate with the employer. If they believe the complaint is worthy of investigation, they contact the employer, provide the details of the complaint, and ask the employer to provide a response to the complaint. Given the nature of the situation, they should give you adequate time to respond to the complaint. But there are law firms, our safety practice, we help clients with these situations. If you feel like you don't know what you should do, I would reach out to an attorney or a safety consulting firm like ours for guidance and assistance. But generally, if the complaint is ridiculous, it's out in left field, you should provide a very thorough explanation of exactly what you're doing to address what was in the complaint. So if there's no PPE being provided, if you can clearly demonstrate that that's a false statement, you want to provide as much information as necessary contradicting the nature of the complaint. And I did want to point out that on April 16th, many people have a contentious relationship with OSHA. And as a safety consultant who's been doing work for 40 years, I agree with that. They are sometimes and oftentimes unreasonable. But on April 16th, they issued a news release. And essentially what they did in the news release is to say that they will recognize good faith effort on the part of an employer. There are many things. If you followed the letter of OSHA law, respirators, if you require somebody to wear an N95 respirator, you are required to develop a written respiratory protection program. You're required to provide a medical evaluation. You're required to provide fit testing. Well, good luck doing any of those things in this environment when offices that would do that kind of work are closed. So the agency recognizes that a lot of these things are going to be very, very difficult to accomplish. So they have backed it down a notch. But I wouldn't tell you that that gives you free rein to ignore everything. In fact, what I would tell you is you need to look for alternatives. If an N95 isn't available, which is one of the more effective tools to use to not only prevent the spread if you're contagious, but the wearer, it also protects the wearer, is to make sure that you've done everything possible. So that means training the employee how to don and doff that respirator, when to change that respirator out with another one. You may not be able to get them in for a medical evaluation, but there are certainly things that you can and should do. And I'm sure our attorneys who are on the call with me will agree with this. Document, document, document. You want to have all of that information documented. The second question I'll quickly answer because I'm not going to go into the detail. If you want to reach out to me, I can send you the details of what a thorough cleaning and disinfection process is. It deals with frequency and the number of times per shift. Essentially, what you have to look for are surfaces that people touch frequently and clean those. Those are doorknobs. Think about it, and I think Corrine mentioned this. We have popcorn, we have pop machines. We may not be able to have those things anymore because if you don't clean the handle on the coffee pot, but everything else is cleaned, when employees go to get a cup of coffee, if that handle hasn't been cleaned, you have a pathway for the transmission of that virus. So I'd be happy to share that information with the participants. It's just fairly detailed and you probably wouldn't be able to write it down as quickly as I'm talking.
Thanks, Lori. This seems to come up a lot. What is the risk of retaliation claims when post-COVID decisions might be perceived in favor of those who stayed on the job? Or just, any other allegation issues that might come up?
Frankly, coupled with the possibility of discrimination claims based on age and things like, and pre-existing disability, this is the one that I really anticipate is going to be the most common thing. There's going to be a suggestion by employees who might have taken emergency paid sick leave or, took expanded family medical leave to stay home with their children, that, hey, my employer believes that that the folks who didn't do that have a stronger work ethic than I do. And therefore, when, maybe they were furloughed or something like that, or maybe when that was lifted, I didn't get brought back. I didn't get the favorable, if we're doing shifts or something, I didn't get the favorable shift. I didn't get whatever might happen to me. I didn't get a raise when other people did, things like that. That is, I think, a risk. And I think to the extent employers can have to, of course, they're going to be faced, especially if you're bringing back folks in phases, that you're going to have to be treating employees differently. You have to be able to articulate a reason that isn't the fact that they took family's first leave as being the reason why it's this person and not the other person. Maybe that's the skill set. Maybe it's the job. Maybe you can think of all kinds of reasons, seniority, all kinds of non-discriminatory reasons why you would make decisions. A lot of people have been talking about, coming off a little bit what Gary was just talking about in terms of office environment, cleanliness, and things like that. Got a lot of employers, by the way, who are simply just doing things across the board, like in an office environment, everybody's going to work 2 days from work and 2 days from home. And how we're going to do that is we're going to say every other office, so that adjacent offices aren't working on the same day. That kind of thing, that takes the retaliation and discrimination out of it. You have to think creatively and you have to think about what kinds of, how you're going to articulate, pretend you were challenged on the decision. How did you make that decision?
Thank you. Jim, should there be a zero illness policy? But if an employee is coughing or sneezing, how can you tell if it's allergies or if they're sick?
Well, I don't know that I go as far as to say a zero illness policy. I do think you could have a policy, a zero COVID-19 like policy. If somebody's exhibiting those symptoms, I think you could definitely put a policy together, a cogent policy together that states this is how we're going to deal with them. And again, be uniform in exercising that policy. But to say all different types of injury, illness are going to be cause to send people home, I think that's an error.
Mm-hmm. Thanks. Corrine, could you talk about the actual thermometer element of this? You know, are you going to test employees when they come in? What type of thermometer should you use for taking temperatures? You know, where do you find those? It seems like, the stock is out of all the stores and perhaps it's all online, but talk a little bit about that process, because that's a totally different way of operating going forward, if that's required or best practice.
So I'll be honest with you, I have not sourced the thermometers yet, so I'm not sure what the availability is. I can tell you that a digital monitor will suffice. I do like PPE. I think it's going to be one of those things where, as we start to bring in those phases, sourcing of that type of equipment to ensure a safe workforce is going to be necessary. But that is going to be one of the requirements that that you would expect for individuals or companies to be looking at how they're going to open up their offices back to working in the office.
Mm-hmm. Okay. Anybody else have any comments on kind of the technical procedures that might be standard going forward?
I guess from a safety standpoint, anyone who's taking the temperature is going to be within close proximity to the person entering the building. So that individual should be wearing PPE. There are infrared thermometers. I couldn't tell you the availability of those, but there are devices that could be used from a short distance to take temperatures.
Mm-hmm. Can we require medical excuse for employees unable to wear masks if employees are required to wear them? Anybody?
Well, that's going to be an interesting one. That's a question I've consulted with our chief medical officer, and he equates it to hard hats on a construction site in terms of a OSHA requirement, if you will, and that, he doesn't believe that there's any medical reason. Now, there might be, some other reasons, but from a medical perspective, any reason why a person would not be able to wear some sort of protective shield over their face. There are allergies and things of that nature, but there are ways to be able to make sure that that is a requirement that's adhered to. That's from my chief medical officer's opinion.
Sure, and I would add to that from a legal perspective that if a person has a medical condition which qualifies as a disability under either federal or state law, then I would suggest that the employer engage in their active process to get more information as to why they can't do that, and if there's another alternative that can be accommodated from the standpoint of the employer, because we don't want to get into a situation where we've breached the duty to accommodate in that scenario. It's going to depend. That is such a fact-sensitive question in terms of what the condition is, whether there's an alternative, maybe there's a different kind of mask, maybe there's different kind of something, and we'd have to get the information from the healthcare provider. You don't talk, we always say to our employers, we're not doctors, employers aren't doctors, we get that information directly from the doctor.
Yeah, I would have to agree. I think Lori hit it right on the head when it comes to how you have to treat it from an ADA standpoint. From the standpoint of creating a policy and addressing it uniformly, both the CDC and the Wisconsin Health Department have suggested that that's something that you might want to require.
If I could jump in, I did see a question pop up. We're on the topic of respiratory protection. One of the participants asked a question about facial hair. If you are wearing a respirator, you may not have facial hair that interferes with the face-to-face piece seal of the respirator. And to be perfectly honest with you, it's a pathway for the virus to get through. Why would you put a respirator on your face that's doing no good when the thickness of your beard is preventing it from sealing on your face? It's a useless piece of equipment at that point. So these are all considerations. I would tell you that that's a training element. And if your people are fearful, they need to shave if they want to come to work and protect themselves from the virus.
I guess you two guys are going to be working at home for a while.
That's right. I think that was discriminatory.
So this is gonna,
is facial hair a protected class?
Yeah, it should be.
Right.
it's overrated. So this is something that is going to come up a lot because of the big change with employee benefits and the extra pay for a while. How to address an employees who don't want to come back to work and would rather take unemployment benefits. How do you deal with that kind of situation?
I would say I get that quite a bit. You know, if a person, it's going to depend on the reason why they're not coming back. Is the reason they're not coming back due to a there's like a several, I guess, step inquiry I would do if I'm an employer. One, maybe you have someone who's furloughed and you're saying, hey, we're back open, come back. And then that person triggers one of the things under the Families First. Maybe they'd be entitled to leave. Let's pretend that's not true. Let's pretend that the person isn't coming back because of fear. I talked a little bit about, you know, what the kinds of things that you can do to alleviate any fear to the extent you can. If it's the person that doesn't want to come back to work simply because they'd rather collect that unemployment, that's a totally different thing. But unfortunately, you know, I'm not suggesting at all that that fear is not legitimate. You know, that some people, you know, they have a legitimate, valid fear. It's not an irrational thing. But if it's, unfortunately, even in those cases, if the person is refusing to work and you are an essential business, or the stay has been lifted or something like that, and they are simply coming back, then you have a situation where they aren't, they're refusing available work, and you can discipline just as you normally would. You know, I've gotten a lot of questions, are they going to get unemployment in that scenario? And I think you approach it just as you would in any other unemployment situation. You're going to get a questionnaire, and I would just recommend to any employer that they answer the question as to the reason for the separation of employment, if that's the case, or the reason the person isn't working, if it's a furlough situation, you know, we have available work. We offered the available work on this day. The person didn't get it. Employers and I and the employees don't decide whether you get unemployment. The UI division does, and we're really unclear as to what the UI is going to do if they have that scenario in front of them. Other states, Oregon, I happen to know, for whatever reason, is one of them who said, you know, fear, deciding not to come to work and being unemployed because I don't want to go to work because of fear is an adequate reason and will not disqualify you for unemployment. Wisconsin, thankfully, is not one of those states who's expressly stated that, but boy, are these strange times, and we just really don't know what unemployment is going to do when they hear from the employer that the person has available work that they refused.
Thank you. I've got one last question, and it's probably something that all the participants need to be concerned about and prepare for. Let's say they get off this webcast, and tomorrow morning they find out that somebody's positive in their office. It's a manufacturing plant maybe. And what are the everybody can add to this. What are the steps? What do they need to do along the way? Should they close down the plant for the day, the week, for 2 weeks? Should they keep it open? But what about the fear factor? Try to address those issues to give the attendees kind of a plan going forward that they can start working on tonight in case that does happen tomorrow.
I would plug into the Wisconsin Department of Health site, and follow some of the guidance there with regard to how you're to react if somebody has a positive test. And that would include initiating the quarantine on that individual, doing the back checking, the contact review, contacting the health department, and cleaning the area. In fact, I'd look at the CDC regulations there and the OSHA regulations for how long the area that person worked in, how long you should wait before cleaning it. Then I would do a thorough cleaning. I'd probably call Gary and I'd say, how the heck do I thoroughly clean this place? And then I believe the CDC guidance also speaks in terms of waiting for a while before that area is occupied again. That's a general outline of the steps. I know there's a few more in both this early CDC guidance and the health department guidance that I might be missing, but that's the drift.
Gary, how about you?
Yeah, I would say there's two elements. One is the emotional component. You know that the grapevine is going to be talking about it. And so absolute transparency on the part of the employer. If you know you have somebody who is a positive COVID-19 case, obviously you want to maintain the privacy of the individual, but you want to let people know. Let them know this happened. I would also advise, and we are beginning to develop sources of companies that specifically come in and do deep cleaning and sanitizing. I would have a relationship lined up with a company that can do that, because you're having an outside party come in who has the credentials of doing this instead of assigning employees internally to do the cleaning. I think that would go a long way, number one, in making sure that it's a professional job, but number two, showing your employees that you're committed by bringing this outside resource in to do that cleaning.
Yeah, you're serious about it. Anybody else have any comments? All right, on that note, I think we should end. It's been a great session. So this concludes the webcast. I'd like to thank Lori Meyer and Jim Conley from Davison Kilthau, Gary Glader with the Horton Group, and Corrine Dykes-Johnson with Network Health. So the slide deck's available online. We'll try to get to some of the additional questions that we weren't able to answer. Please go to fill out the online survey, and I think you'll be able to download the deck and provide us with some feedback as we look to do more webcasts like this in the future. And again, thanks everyone for taking the time out of your day to learn about what we need to do to prepare our companies as we get fully back to business. Let's hope that Badger bounce back starts bouncing quickly. And it can't happen soon enough. So with that, have a great rest of the day, and thanks again, everybody.
Stay well.
Thank you.
Yeah, you too.
Social distancing. Thank you.
All right, take care.
Yeah, I'm leaving the meeting.